so much for joining us today. I'm Elizabeth Dwyer-Sandlin, and you are here for yet another installment of the 12 Days of Healthcast. And today we are going to talk about our frontline healthcare workers and personnel. And joining us for that discussion are Steve Nuanez, Director of Employee Well-Being, and Eddie Rojas Alvarado, who is the Program Coordinator for Employee Well-Being and the Health Literacy Office. Thank you for joining us, Steve and Eddie.
Thank you very much, Elizabeth. Appreciate you inviting us.
Yeah, thank you for having us.
It's my pleasure. So this is a pretty important conversation that we wanted to make sure that we took some time to highlight, because we are so deep into this pandemic and we have so many people who are living with it every single day, just in the work that they do. And I wanted to hear a little bit from the two of you about what it's like to be navigating those spaces still, and what kinds of things you are both doing in your work to help support our frontline healthcare personnel.
Yeah, thank you. It really is a difficult time, and it's really striking sometimes how much the staff in the hospital are doing and how much they're really managing. I don't think we always kind of understand, but the hospital is like way over capacity. It's beyond full. And every day, you know, folks are showing up to care for those patients, and it's really inspiring what they're doing. But it takes a toll, you know, it takes like such a toll on them, and there is a lot of exhaustion, and you know, burnout is always a risk for everybody that's there. So we've been, you know, trying to do like a lot of different types of things. We go on rounding, so we go rounding on the ICUs and the COVID units, just to, we have snacks, and we just bring things around to folks to check in and see how they're doing, and make sure that, you know, just that they know that, that somebody's there thinking about them and supporting them. A lot of times folks are reaching out now. In fact, we see this more often now than we have in the past. People asking one-to-one, kind of saying, hey, could you know, I just need to talk a little bit about things that are going on. So offering one-to-one support, and sometimes just listening sessions. So just being able to talk with folks, you know, groups of people to see like, how are you doing? Like, how are things going? So those are, yeah, some of the things that we've been doing.
Yeah, my brother and his wife and a dear friend of mine are all healthcare workers and have been involved, you know, in the thick of this pandemic for a long time. And they've all sort of tried to take this stance of like, well, the pandemic has been hard for everyone. And I keep reiterating to them, no, it is harder for you. you get to take some extra love and extra support and extra care, because so many of us can't even imagine what these folks are facing day in and day out in a pretty relentless way at this point. So I'm really glad we're having this conversation. And tell us a little bit more about some of these, you know, interactions and the things that you find are most meaningful to folks. We had mentioned a little bit before we hit record here about thank you cards. Can you speak to the significance of something that sounds simple but has a big impact?
Yeah. What I've noticed is that every once in a while we'll get from the community, you know, maybe kids or folks will make thank you cards for healthcare workers. There you go. Thanks,
oh, wait, Eddie has to speak so we can see his face.
Okay, yes. So we do get these thank you cards from community members, just different colors, people coloring things in. It's great. And then sometimes there's little messages inside, and I don't know if you can see, but this is from 10-year-old Aspen, and 10-year-old Aspen says, thank you for helping the sick and taking care of them.
Oh, I love that.
Yeah, so it's really great to get these kinds of cards and be able to give them to staff in the hospital. It's really wonderful.
I think there's so much of that feeling, like, you know, nobody understands what we're going through. Nobody sees us. Nobody, you know, really understands how difficult it is. And of course it is hard to understand, you know, what that is really like going through it. But just recognition that, like, I know you're there. I see you there, and I know what you're doing, and I feel so grateful for it. I mean, that's really powerful.
Absolutely. And for folks who want to send these cards, who might not know how to go about doing that, do we have an avenue for them to reach either of you, or how to get things to the hospital for folks?
Yeah, I can speak a little bit on that, Steve. We got with Volunteer Services with Barbara Teamer, our director over Volunteer Services, and her and I have decided that any thank you cards that come in can go through our department, through Employee Well-Being. They can be addressed to me, so you can mail in cards if you'd like to Eddie Rojas Alvarado, and you can put Employee Well-Being Department on there as well and send them to our office. We're located at 933 Bradbury Drive Southeast. Our zip code is 87106, and we're suite 1100.
Perfect. Okay, great. We'll repeat that at the end of this so
Sure.
folks can be sure to get it. So we've talked about these wonderful cards and how people can send them. Steve, you mentioned a little bit about listening and just having one-to-one connections with folks. I've also heard about things like snacks and pet rounds. How important are these kinds of means of support for our healthcare folks?
Yeah, they're really huge. In fact, I would like to let Eddie talk a little bit about pet rounds, because I think he's been really involved in that, and they're really great.
Yeah, so pet therapy has been a huge blessing for all of us, I think, at the hospital and as healthcare workers, being able to partner with the volunteers of the Southwest Canine Corps of Volunteers. They're a group of individuals that volunteer through the hospital, and they've been the group that we've been taking out for our pet therapy rounds. We take anywhere from 4 to 6, sometimes even 8 dogs out with us, to the ICUs, to the emergency rooms and the COVID units. And they're there for staff this time. When we're with them, they're there for the employees. So a lot of staff will think that, oh, are you here for the patients? But no, we're here for you guys. And then you see this light of smiles and bright eyes when they see the dogs. It's just so wonderful to be a part of that. As a dog person myself, it has just been such a great experience to just see how having a dog around and just the presence of an animal can bring the stress levels down for just a moment. And if it's just a moment, then we've done our jobs, right? Just giving employees that second to kind of decompress a little bit, and release that stress that they're carrying with them.
That's so fantastic. I love hearing that. And yeah, there's, nothing quite like the pure, unadulterated love of an animal to help get you through a day. So that's really, really wonderful to hear. I know that I sometimes see inquiries coming in, and they always, spike a little bit around either the holidays or when we have a very public realization around spike in cases for COVID and things like that, that people are asking things like, how can I send a food donation? How can I buy lunch for, the nursing staff today, or things like that? Is that another thing that is available to the public? And would that also go through the volunteer services office?
Yeah, volunteer services and Barbara Teamer and volunteer services is the person to contact, and she can help arrange and coordinate that. And we work closely in collaboration with them. So it's a good, it's good teamwork.
Perfect. That's great. Okay, we will include Barbara's contact information. I'll make sure that we get a little card up here at the end with all of the names and emails and addresses people need to know so they can reach out to folks. And then lastly, for our conversation today, I just wanted to touch on for folks who are watching who might have healthcare workers in their lives, whether it's family or friends who they want to support and are maybe feeling a little bit like, I'm not sure what to do anymore, or at this point, or like, do you have any advice for how folks might reach out to the healthcare workers in their personal spheres and to let them know that they're around and available for any kind of support?
Yeah, I mean, I think that it's so important. And I think people kind of know this intuitively, but it's just so important to acknowledge kind of the burdens that people are carrying at work and what it is that they might be carrying home. It's so difficult. We talk with folks about, trying to make that transition from your being at work to trying to kind of let some of that go to be able to move back into your other life outside of work. but it's can be so intense that it's just not always an easy transition to make. And so being able to listen and just to kind of understand, like, what do people need? Like, what is it that that person needs when they come home? I've talked with some people and they're like, do not talk to me, like, for 30 minutes, like, don't even try to talk to me. And other people, like, the first thing I want to do is hug my kids and, kind of do those things. So I think everybody kind of has different ways of kind of doing it, but being able to just kind of trying to understand, kind of, and have those conversations, what are some of those needs? And if you have other ideas, Eddie, other things.
I just wanted to mention, Elizabeth, I thought it was kind of interesting that you mentioned earlier about your family and saying how we healthcare workers, we always say, well, like, everyone's having a hard time through the pandemic. It's really hard for healthcare workers to receive care themselves. This is something that I myself, I was an inpatient tech through COVID at the main hospital, and I was also an outpatient MA. So I understand that. And so, like I said, it is hard for us to receive care. So, like Steve said, it's important to just listen to what each individual needs. Sometimes, like he said, you go home and you don't want to talk to anyone. Or sometimes you go home and you want to have a conversation and a venting session with your family and be able to just kind of get it all out off your chest. For me personally, what I've been doing, and something we've discussed in our office of how to kind of disconnect ourselves from our work and our personal life, is I've brought more attention and awareness to the physical action of removing my lanyard when I get home, and hanging that on the hook where it belongs, and putting my work bag where it belongs at home, and just bringing that awareness to those physical actions has been such a huge opportunity for me to be able to have that disconnect between my work life and my personal life.
That's really powerful. I think it sounds simple, but it's one of those things that, to really just give yourself that intention, a gesture, a
Exactly.
moment. That's really beautiful. Thank you for sharing
Exactly
that
that.
with us. And I think what you're saying is so spot on in terms of listening, which can, just hold so much more power than I think a lot of us realize. So I'm going to give this advice to myself while I give it to other people, which is you don't always have to fix anything. You can often just be there and listen, and that can be the greatest gift that you can give. So
One thing I
yeah,
hear sometimes, Elizabeth, just very quickly, is like, sometimes I've heard people say, I tell them about the things that are happening at work, and then my family says, why do you stay there? Don't, you need to leave. Don't do that, leave. And I think sometimes people, like, that's one of the things that people is not sometimes as helpful, and I think people have to find their way with that. But like you said, I think just listening and being present, it's really, it's the kind of support I think that people appreciate the most.
absolutely. And I was going to ask if you had any closing words that you wanted to share. So Steve, is there anything you want to add on to that beautiful little nugget of wisdom?
I think just, just saying that one, thank you for doing this, and thank you for focusing on this. And I mean, I think always, we're thinking about, like, I hope everybody gets vaccinated and everybody gets boosted, and like, that's like the best, like the biggest thing. And I think just recognizing that so much of the burden of this pandemic is being borne right now by the healthcare workers, and that they really are doing this just kind of exceptional job at a high cost, really. And so remembering them and recognizing them and thanking them, I think, is so helpful.
And Eddie, is there anything that you want to add as we close today?
Just to echo what Steve said, just making sure that your loved ones and the healthcare workers in your life are aware that you see them, that you're listening to them, and that you don't necessarily understand what's going on at the hospital, but you can be there for them by just being present in the moment, um, and being that kind of beacon of relief for some of us that go home, um, and expect to just kind of to let it all go.
That's really great. Thank you both so much for sharing all of this. It is really wonderful to have you on the show. And we will post all the information for where the public can send their support and show that they are hear that they're listening, that we are here for all of you. So thank you so much for being with us today.
Thank you.
Thank you.